Welcome to the training presentation on Calibra. The Calibra product range comprises several dental resin cements indicated for permanent placement of indirect restorations. This training presentation will help you to understand the basic concepts of indirect restorations as relevant for selling dental cements. You will also learn about the features and benefits of the various Calibra cements and how to sell them effectively. This training presentation is split in two sections. Firstly, you will hear about dental cements in general and what they are used for. You will learn which factors impact the choice of the right cement and what types of restorations are available. You can skip this section of the presentation if you already feel comfortable with the basic concepts of indirect restorations and dental cements. Secondly, the features and benefits of Calibra resin cements will be introduced. You will learn about how to probe around related customer needs. We will begin with some basic aspects on the subject of dental cements. What are cements used for? What types of cement are there, and which factors are decisive for the use of a specific type of cement? What are indirect restorations, and how can they be reliably bonded with the tooth structure? Which curing mode works best for which situation? How should the restoration and tooth structure be conditioned to ensure successful cementation? These and other fundamental questions should be answered in the following. So why do dentists need cements at all? And what exactly is an indirect restoration? Indirect restoration of a tooth is necessary if its crown is so severely destroyed, for example, due to caries, that the defect can no longer be treated with a filling fabricated directly in the oral cavity by the dentist. Instead, an artificial dental crown, custom fabricated extraorally, is cemented on the tooth. Dental cements must ensure a permanent bond between the tooth and restoration, as well as the tight seal of the tooth structure. For a long time, restorations fabricated using precious metal, such as a gold crown, were the standard restoration in such cases. Nowadays, patients increasingly request white restorations. This can be achieved by fitting ceramic restorations. Differentiation is made between all ceramic and porcelain fused to metal, which means restorations where porcelain is added to a metal base. Porcelain veneered restorations, particularly all ceramic restorations, integrate very effectively in the surrounding dental arch and are therefore vastly superior to metal restorations with regard to the aesthetics. With all ceramic restorations, the cement used can have an effect on the overall aesthetic result, as the color of the cement can be seen through the ceramic. The following video illustrates an example of the luting procedure of an all-ceramic single crown using a self-adhesive cement. In this video, a patient receives a full ceramic crown, which is placed using Dentsply Sirona's Calibra Universal. First, the provisional crown is removed. Much of the cement remains inside the provisional, which facilitates cleaning of the prepared tooth. After ensuring proper fit and occlusion, Calibra Universal is applied to the entire internal surface of the final full ceramic crown. After placement of the crown, excess Calibra resin cement can be light cured for up to 10 seconds overall to reach a so-called gel phase. In their gel phase, Calibra cements are very easy to clean up. Their wide tack cure window is one of the most important features of the Calibra product range. It is not only single teeth that have to be restored indirectly. If teeth are completely missing, a gap is created in the dental arch. Fabrication of a fixed partial denture may be necessary in such cases. FPDs are also luted using dental cements. In these pictures, you will see a case presented that makes it necessary to fabricate an FPD in the upper and lower jaws. In the following, the principal treatment procedure will be briefly described using the example of the present case. Firstly, the teeth supporting the FPD, The so-called abutment teeth are prepared by the dentist. This is also called a preparation. A provisional restoration is then fabricated to bridge the time between sessions. Provisional cements are used for this. Provisional cements, however, are not a subject of this training course. The fit for the restoration is checked at the so-called framework try-in. All ceramic zirconia FPD frameworks are shown here. The porcelain veneered restoration is then permanently fitted. A full range of different luting cements is available for permanent luting of restorations. But what is the correct cement? The choice of cements depends on three important factors. Firstly, on the properties of the different cements. Secondly, on the individual clinical situation. Thirdly, on the restoration, or more precisely, on the material used for fabricating the restoration. The choice of cement is derived from the interplay of these three factors. We will discuss these factors in the following to allow you to understand when a particular type of cement should be used. Firstly, let's take a look at the different commercially available cements and their characteristics. Basically, a differentiation is made between powder liquid cements and modern resin cements. Conventional powder liquid cements are mixed manually. Examples include zinc phosphate cements, such as the Dentsply Sirona product D-Tray Zinc, or also glass ionomer cements, such as Aquacem. Conventional powder liquid cements set purely chemically. Furthermore, there are some powder liquid cements that also have an additional resin component and not only set chemically, but can also be light cured. These products are also often available in Automix prescriptions. On the other hand, purely resin cements are available to dentists. Resin cements are a new development. They polymerize, which means harden, with few exceptions, dually, meaning both chemically and also under exposure to light of a suitable wavelength. Differentiation is made in the resin cement group between adhesive cements and self-adhesive cements. The term adhesive cement indicates that this type of cement should be used in combination with an adhesive, for example, Prime & Bond Elect, to achieve the greatest possible bond to the tooth. In this case, Dentsply Sirona provides the product Calibra Ceram and Calibra Veneer. In contrast, the latest resin cements are self-adhesive, meaning they bond by themselves to the tooth, making them very easy to use. Dentsply Sirona supplies the product Calibra Universal here. This presentation gives the names of different competitor products from different cement categories. Well-known brands in the powder liquid cements sector are Fuji and Keytac Sem. Key competitors from the adhesive resin cement category are Reliax Ultimate, Multilink Automix, and Nexus NX3. Reliax Unisem and Maxem Elite are key competitor products for self-adhesive resin cements. What are the advantages and disadvantages of powder liquid cements? Powder liquid cements only have moderate aesthetic properties. They are often only available in a few tooth shades or are simply gray. This can be important in combination with all ceramic restorations, as the cement layer can affect the overall aesthetic impression of the restoration, for example, that of an all-ceramic crown. In addition, powder liquid cements only bond moderately well to the tooth. We will come back to this characteristic again later. A big advantage of powder liquid cements is their tolerance to saliva or blood. If dentists have difficulty keeping the tooth to be treated dry during the cementation procedure, as seen in this picture, a powder liquid cement is then indicated. Resin cements cannot be used in such situations. Let us now turn to resin cements. A disadvantage of resin cements, regardless of whether the adhesive or self-adhesive type, is their moisture sensitivity. The treatment site should be effectively protected from saliva or blood exposure when using resin cements for fitting restorations. In the case shown, the site is protected by applying a rubber dam. If the treatment site cannot be protected from moisture, a powder liquid cement must be used. On the other hand, resin cements generally have outstanding aesthetic properties. They are mostly available in many natural tooth shades. More importantly than their aesthetic properties, however, is their effective bond to the tooth. Resin cements bond reliably with the tooth structure. Adhesive cements bond even more effectively than self-adhesive cements. Both properties are indispensable for highly aesthetic, relatively translucent, all-ceramic restorations, as shown here, and are frequently used for treating single teeth. Powder liquid cements are contraindicated in this case. In summary, it can be said that powder liquid cements on the one hand and resin cements on the other hand have diametrically opposed characteristics. Resin cements have ideal aesthetic properties and high bond strengths, but don't tolerate moisture. Powder liquid cements behave in exactly the opposite way. Resin cements are practically divided according to the type of bond and curing mechanism. Calibra cements from Dentsply Sirona can be considered as representative hereby. The products Calibra Veneer and Calibra Ceram are used in combination with an adhesive, for example, Prime and Bond. In contrast, Calibra Universal is a self-adhesive cement, which means it bonds by itself to the tooth, making its clinical application particularly easy. Calibra Veneer is only light-cured. Calibra Ceram and Calibra Universal, however, are so-called dual curing cements. This means that they can be both chemically cured as well as light-cured. Two components are always required for chemical curing that must come into contact with one another to activate the curing mechanism. You can recognize that a cement can at least be chemically cured by the fact that it is supplied in the double barrel presentation. As said, you will find the same variety of curing modes and adhesive mechanisms among competitor products. Let us now take a look at the important clinical situations that influence selection of the cement. You have already got to know an important aspect that influences selection of the cement, namely protection of the tooth to be treated against contamination with saliva or blood. If a tooth cannot be kept dry during the cementation procedure, a powder liquid cement is then indicated. However, this is not the only factor to be taken into consideration. An important factor for selection of the cement is also how much retention is available to ensure anchorage of the restoration. Two aspects are decisive in this case. Firstly, the conicity of the preparation, meaning the angle formed by the prepared surfaces of the tooth to the tooth axis, and secondly, the retention surface available, which essentially depends on the length of the tooth crown. A prepared tooth with a minimum residual crown height of 4 mm and conicity of no greater than 20 degrees is considered adequately retentive. In such situations, the use of powder liquid or self-adhesive resin cements is the standard of care. For shorter residual crown heights or more pronounced conicity, an adhesive resin cement such as Calibra Ceram should be used to ensure highest possible adhesion and thus permanent retention of the restoration. Here are some examples of this. The anterior preparation shown in this picture has adequate retention. The conicity is approximately 10 degrees to the tooth axis, and the tooth crown is sufficiently long. Dentsply Sirona recommends using Calibra Universal in this situation. Here, a second preparation for comparison. The preparation is highly conical. The use of the adhesive resin cement, Calibra Ceram, is recommended in this case to maximize the bond to the tooth. A crown fitted using powder liquid cement would de-cement after a short time in situ, meaning it would become detached from the tooth. Another example illustrates the influence of different lengths of crown. This patient only has a very short clinical crown. After preparation, the retention surface available is minimal. Adhesive cement should also be used in this case. Inlays, onlays, and partial crowns also only have little retention surface. Here, Dentsply Sirona also recommends using Prime and Bond in combination with Calibra Ceram for cementation. Veneers are used for aesthetic correction of anterior teeth. Very often, they are made from silicate ceramic. Veneer preparations also offer only little retention surface. Adhesive cementation with Calibra veneer is recommended. We will now look at the third and final factor which influences selection of the correct cement: the type of restoration and the material from which the restoration is fabricated. Source materials for fabricating fixed partial denture restorations are on the one hand precious or non-precious metal alloys, and on the other hand ceramics. A crown or FPD can either be fabricated solely using metal or ceramic. Both materials can, however, also be combined. These are then referred to as metal ceramic or porcelain fused to metal. The framework of a porcelain fused to metal restoration is cast in metal and then veneered with porcelain. To what extent does the material used for fabricating a crown or FPD play a role with regard to the cement to be used? For this, it is important to be aware that certain ceramics only have low flexural strengths, as shown in this animation. It could also be said that they are brittle. Corresponding all-ceramic restorations can therefore already fracture with comparatively low masticatory forces. One of the main objectives of an adhesive resin cement is to prevent this. There is an almost incalculable number of ceramics available on the dental market. Which of these ceramics have a low flexure strength and which a high? Which must be luted using an adhesive cement and which not? Fortunately, the majority of products can be divided into only two groups. Either the product is a so-called silicate ceramic or an oxide ceramic. Silicate ceramics are popular due to their outstanding aesthetic properties. They are mainly used for restoration of single teeth. Unfortunately, they are mainly brittle and therefore fracture easily. For this reason, they must be cemented using an adhesive resin cement. Oxide ceramics, in contrast, are exceptionally fracture resistant and thus are used as a base material for FPD frameworks. They don't require any additional stabilization from a resin cement. However, they are relatively opaque and integrate less effectively in the surrounding tooth structure. The product Zircon, a high-strength zirconia ceramic, is an example of an oxide ceramic from Dentsply Sirona. By the way, when talking to dentists, you will often hear the term glass ceramic, which many all-ceramic restorations are made of. Do not be confused. Glass ceramic belongs to the group of silicate ceramics. Silicate and glass ceramics also include more recent product developments, which are characterized by their higher strength. For example, the products Celtra Duo and Celtra Press from Dentsply Sirona. Celtra Duo has a flexural strength of 370 megapascals after glaze firing, indicated by the flame symbol. The pressable ceramic Celtra Press over 500 MPa. Small FPDs can even be fabricated using Celtra Press. One final aspect that we have to shed light on, in the truest sense, is the curing mechanism of the different Calibra composite cements. Silicate ceramics are basically translucent. Both the resin cement and also adhesive used can therefore be light cured through the restoration. However, the opacity increases with the wall thickness of the restoration. Use of the dual curing Calibra Ceram is recommended to ensure that the cement layer is always adequately cured. Zirconia and metal ceramics, on the other hand, are mostly or completely opaque and must consequently always be luted using a dual curing cement. Calibra Universal is a suitable cement for this purpose, provided the preparation is sufficiently retentive. Calibra Ceram should be used with a non-retentive preparation. Here, both types of restoration are again shown in cross-section. You can see the low translucency of the zirconia and metal bases of the restorations. The complete opposite is true with veneers, which are used for aesthetic correction of anterior teeth. Veneers must always be placed adhesively. As veneers are very thin and highly translucent, Calibra veneer cement can be very easily light-cured through the veneer. Calibra veneer is thus a purely light-curing cement. Purely light-curing cements are also less susceptible to discoloration in the long term, which is particularly beneficial with aesthetically demanding anterior restorations. Prior to the cementation, pre-treatment of the restoration surface is still common sense and shall be briefly discussed below. We will then look at the actual cementation process. The surface of silicate ceramic restorations is conditioned using hydrofluoric acid before fitting to maximize the bond of the resin cement to the ceramic. Firstly, hydrofluoric acid is applied to the inner surface of the restoration in a concentration according to the manufacturer's specifications, and rinsed off using water after a few seconds reaction time. Etching produces microscopic roughness on the surface of the ceramic, so that the cement can bond better with the surface. Salinization of the silicate ceramic surface is then recommended. Silanes bond the ceramic surface chemically to the resin cement, enhancing the bond. Dentsply Sirona provides such a silane bonding agent under the brand name Calibra. Surface treatment methods used for resin bonding to silica ceramics are not reliable for zirconia ceramics. Instead, sandblasting is recommended to achieve surface roughness. The procedure is typically carried out by a dental technician using a sandblasting chamber, like the one shown in this picture. This is an overview of the entire cementing procedure for silicate ceramic. Firstly, the surface of the restoration is etched using hydrofluoric acid. The surface of the tooth structure is etched using phosphoric acid. Both acids are rinsed off after a few seconds reaction time. Silane is then applied to the ceramic and prime and bond applied to the tooth surface. The solvent of the adhesive is air-dried. The adhesive layer must be light-cured right after application if the wall thickness of the ceramic exceeds 2.5 millimeters. The surfaces of the tooth and ceramic are now coated with resin cement, and the restoration placed in position. The cement is then light-cured 20 seconds from each direction: buccal, lingual, and occlusal. This table once again shows an overview of what has been learned. Celtra Duo, a silicate or glass ceramic, should be etched, silanized, and adhesively luted. Sandblasting is suitable for Cerex zirconia, an oxide ceramic. Because of its high flexural strength, adhesive is not required for luting. In this case, Dentsply Sirona recommends Calibra Universal. Powder liquid cements are frequently used in the dental office. Please keep in mind that there is no need to be concerned about light curing the prime and bond adhesive layer impacting fit of indirect restorations. Prime and bond has a very low film thickness of less than 10 micrometers. Let us summarize what you have learned. Please note the following. There are powder liquid and resin cements. There are adhesive and self-adhesive resin cements. Resin cements are contraindicated in cases where the preparation has been contaminated with blood or saliva. Powder liquid cements are contraindicated for restorations with low flexural strength. Single, all-ceramic crowns are typically placed with prime and bond active and Calibra Ceram because they are made from lower strength materials. In the case of highly resistant all-ceramic crowns, or FPDs made of Celtra Duo or Celtra Press, as well as zirconia or metal alloys, The choice of cement depends on the preparation shape. In the case of retentive preparations, Calibra Universal can be used. Calibra Universal is recommended for cementing posts. Inlays and onlays should always be cemented with Prime and Bond Active and Calibra Ceram. Veneers are always used with pure light curing with Prime and Bond and Calibra Veneer. Here is an alternative summary of what has been learned, this time in the form of a flowchart. With non-retentive preparations, restorations are bonded with Prime and Bond and Calibra Ceram, unless veneers are being placed. If the preparation offers sufficient retention, restorations can be bonded with Calibra Universal. This rule does not apply to all ceramic restorations with lower flexural strength. In this case, the use of Prime and Bond and Calibra Ceram is again recommended. Now, let us consider the advantages and benefits of Calibra cements, as well as some suggestions for possible sales negotiations with customers. The three Calibra versions, Ceram, Universal, and Veneer, have some product advantages in common, while some others are specific. Let us first take a look at the shared advantages. The first and perhaps most important advantage is in the tack curing or extended gel phase of up to 10 seconds, provided by all Calibra cements. But what does tack curing of cement and gel phase mean? When an indirect restoration is cemented, excess is created, which exudes from the gap between the restoration and tooth preparation. This excess must be removed by the dentist. The cleanup cannot be performed as long as the cement has a fluid consistency. With resin cements, the excess is therefore often light cured for a few seconds using the polymerization lamp. The cement excess is converted to the so-called gel phase by this short tack curing, an intermediate state between fluid and solid. Excessive curing of the cement excess is critical. Even when exposed to light for slightly too long, cement excess can become so firm that it can only be removed using a burr. Gingiva, restoration, and adjacent teeth, however, would inevitably be damaged during cement removal. On the other hand, cement excess is very easily removed in its gel phase. It is removed using dental floss in the interproximal region and using a dental instrument such as a probe in the buccal and lingual region, as can be seen in this picture. The special feature of Calibra cements, Ceram, Universal, and Veneer is that they also reach their gel phase after up to 10 seconds light curing, meaning that they can be easily cleaned. We would like to illustrate how long some key competitors' products can be light cured without becoming so firm that they can no longer be cleaned up easily. Firstly, we will look at Calibra in comparison with Multilink Automix from Ivoclar Vivident. After 2 seconds, both products are still in their gel phase, even though Multilink has already clearly solidified. Calibra is still easy to remove after 5 seconds exposure. In contrast, Multilink is already so solid that it can no longer be cleaned up using an instrument. Calibra, on the other hand, is still in the gel phase after up to 10 seconds exposure. Now a comparison between Calibra and Reliax Ultimate. After 2 seconds exposure, Calibra is easy to clean as expected. Reliax Ultimate, in contrast, is already no longer separable using an instrument. Here is the result after 5 seconds exposure. Reliax is completely solid. Please note how much force is applied to the probe. Let us now see how we can probe for stress-free cleanup, the requirement for this feature. Here is a sample sales call as an example of how that could work. Let us now see how we can probe for stress-free cleanup, the requirement for this feature. Here is a sample sales call as an example of how that could work. Doctor, are you using resin cements to place indirect restorations?
Indeed, I use resin cements for many cases.
Do you tack cure to facilitate cleanup of excess cement?
I do. It saves me a lot of time.
If you failed to meet the tack cure window of your product and consequently overcured the excess cement, what would happen?
Well, that would be a disaster scenario. I would have to clean up with a burr and thus damage the restoration, gingiva, and sound tooth structure.
I understand. Would you find a resin cement helpful that offers an expanded tack cure window of up to 10 seconds? Incidentally, due to their dual curing characteristics, Calibra Ceram and Calibra Universal Cements form a gel phase without tack curing with light, and in fact, it forms approximately 1 to 2 minutes after application. In this case, the gel phase lasts for approximately 45 seconds. With many competitor cements, in contrast, the gel phase only forms after 3 to 4 minutes, and at about 30 seconds is shorter. This results in a longer waiting time and less time to clean. Give your customers the opportunity of trying and comparing Calibra's extended gel phase for themselves. The gel phase demo tool, which you have just seen in some short videos, is available on the sales compass for this purpose. Together with your customer, dispense a sample of Calibra, light cure it, and compare the Calibra gel phase with the cement currently used by your customer. This great hands-on tool for demonstrating the Calibra cementation procedure and its easy cleanup feature is available from Infinident, Germany. Infinident is a Dentsply Sirona company that supplies high-precision, superior quality products around CAD/CAM technology. Infinident offers pinned models and crowns, suitable for cementation with Calibra Universal. Please note that the models are made from resin. In order to demonstrate the easy cleanup, it is advisable not to apply an adhesive to the preparation, as it would create a bond between the cement and gingiva. This will make demonstration of the gel phase feature more difficult. Hence, only Calibra Universal should be used with this tool. Please note the partial arch is reusable and thus a one-time investment. If you are talking about the extended gel phase of Calibra cements, don't forget to point out the following to your customers. Excess cement should be tack cured on the buccal and lingual aspects of the tooth. The proximal areas of a natural crown are, however, accessible to light from both sides. It is better to keep the polymerization lamp moving to guide it along the excess and light cure for no longer than 5 seconds, in particular buccally and lingually. Another aspect to note is the type of polymerization lamp. It is important to know in this connection that 2 different so-called initiators are used in Calibra cements for activating curing, namely camphorquinone and acyl phosphine oxide. These 2 substances react to 2 different wavelength ranges of light. Camphorquinone is matched to the use of blue LED light between wavelengths of 440 and 480 nanometers. Acyl phosphine oxide, on the other hand, reacts to light with a wavelength of up to approximately 400 nanometers or less, as emitted in particular by older generation light curing units, so-called halogen lamps. Monowave LEDs, which emit light with a wavelength of 440 to 480 nanometers, for example, Smart Light Focus from Dentsply Sirona, are tailored to the camphorquinone initiator. Polywave LEDs, in contrast, emit light in a much greater wavelength range and can therefore also activate other initiators in addition to camphorquinone, for example, acyl phosphine oxide. This results in accelerated curing of Calibra cements and a shorter gel phase. Important polymerization lamps that are compatible and those that shorten the gel phase are listed here. Please note that this list is not complete. A comprehensive list of curing lights can be downloaded from the Sales Compass. Common to all 3 resin cements is shade-stable chemistry that contains no typical benzoyl peroxide amine initiating system, which would cause yellowing over time. This virtually eliminates shade shifts of the Calibra cement on aging. In a test on shade stability, samples of a range of resin cements were prepared and light cured. The aged samples were stored in 37 degrees Celsius distilled water for 24 hours and 60 degrees Celsius distilled water for 8 weeks. The comparison of aged versus unaged samples show significant discoloration of some of the competitor cements. There is only very slight alteration of the shade of Calibra. We will now discover whether our customer considered a cement with enhanced shade stability beneficial. Doctor, do you use resin cements to place indirect restorations?
Indeed, I place many highly aesthetic all-ceramic restorations like inlays, onlays, or veneers, which require adhesive cementation.
Does shade stability matter in context with those restorations?
It does. The more translucent the aesthetic restorations are, the more a discolored cement can negatively impact my result long-term.
So can shade shift of the cement create patient dissatisfaction?
Yes, and in a worst case, I would need to replace the restoration.
I see. Would you be interested to hear about a resin cement with superior shade stability? Another advantage provided by both Calibra Ceram and Calibra Universal is the fast buildup of high bond strength in the pure self-cure mode. Before we look into bond strength test data, you should know how bond strength is actually measured. The most common test method is the so-called shear bond strength test. With this test, a resin cement sample is bonded to a tooth surface. The cement sample is sheared off the surface by means of a blade positioned perpendicular to the tooth cement interface. A computer-connected test device increases the force applied in a controlled manner until the cement sample comes off. Please note that bond strengths to enamel and dentin can produce different results and must therefore be considered separately. The test results are always mean values based on repeated measurements. The bond strengths of Calibra Ceram and Calibra Universal are shown in the following illustrations in different scenarios, and in comparison with key competitors. All cements examined have been used exclusively in the self-curing mode. Let us first look at the performance of Calibra Ceram. Displayed are shear bond strengths in megapascal achieved by our product and competitors Reliax Ultimate and Multilink Automix. Prime & Bond active adhesive was light cured, while Scotch Bond Universal and Multilink primers A and B were not, as per manufacturer's instructions. Please note that Multilink cannot be used in an etch and rinse mode. As mentioned, all cements were self-cured. The specimens were debonded after 6 minutes. The bond of self-adhesive cements without light curing develops much slower. In such scenarios, buildup of the bond strength in the long term is therefore of particular interest. How fast does the bond strength of Calibra Universal build up? Generally, bond strengths for self-adhesive resin cements are somewhat lower than those obtained with adhesive resin cements. However, compared to competitors' self-adhesive cements, Calibra Universal builds up bond strength continuously and fast. After 6 minutes, Calibra Universal has developed a bond strength of around 5 megapascals. 1 hour after placement, the bond strength exceeds 8 megapascals, and 12 megapascals after 24 hours. Reliax Unisem and Maxem Elite build up bond strength much more slowly. Their final bond strength after 24 hours is also significantly less. For the sake of completeness, the bond strengths of Calibra Universal are again shown on this bar chart, though this time not only on dentin, but also on enamel. You can see that the final bond strength of Calibra Universal is superior to that of competitors, particularly on dentin. Dentists often recommend patients not to fully or only to carefully load restorations for several hours after fitting. Find out whether your customer would find a cement beneficial that already produces a loadable bond to the tooth structure after much less time. Doctor, which cement do you use for indirect restoration placement?
I use a resin cement.
After placement, how much time do you recommend your patients to wait before loading the restoration?
I recommend waiting for several hours. I want to make sure the cement has had enough time to set, especially in self-cure mode.
I see. Does the final bond strength also matter?
It does. High bond strength enhances restoration survival.
I understand. Would it help to have a resin cement with high final bond strength that builds up fast? Faster buildup of bond strengths is one thing. Guaranteeing it long-term is another matter. An efficient cement should not only produce a reliable bond initially, but ensure it long-term. Studies by the University of Alabama in the United States have shown that Calibra reliably retains restorations, even after simulated aging. After 10,000 cycles of so-called thermal shock stress, in which crowns cemented to tooth structure are stressed by temperature fluctuations between 5 and 55 degrees Celsius, the crowns were removed from their dies and the force required to remove them measured. The cemented crowns were fabricated using the silicate, respectively, glass ceramic Celtra Duo from Dentsply Sirona and IPS Emax from Ivoclar Vivident. Calibra Ceram and competitors' products Multilink Automix and Reliax Ultimate were used for cementation according to the instructions for use. Calibra Ceram showed superior results in combination with IPS Emax, but with Celtra Duo in particular. Incidentally, the bar in the middle, indicated by an asterisk, shows the result of the test for samples in which our prime and bond adhesive was actively light-cured through the crown. Comparably high bond strength is also created in this scenario. If you already have some experience in the sale of restorative products, in particular adhesives and cements, then you are probably aware that, up to now, a third component was required for the application of dual-curing adhesive cements, namely the so-called self-cure activator. Thanks to their modern, innovative chemistry, this is no longer required for Calibra Ceram and Prime and Bond. The self-cure activator can be omitted, another customer benefit. Please note, Calibra Ceram can also be used in combination with other adhesives of the Prime and Bond brand. For example, Prime and Bond XP. In these cases, however, the self-cure activator must still be used. The adhesive layer must be cured in any case. Calibra Veneer is the product of choice for placing veneers. It has been successfully on the market since 2005 and is a reliable material for purely light-curing cementation of highly aesthetic anterior restorations. Calibra Veneer is complemented by the shade-optimized try-in pastes. Try-in pastes are used to check the impact of the cement shade on the overall aesthetics before placing the veneers permanently. The shade reproduction of Calibra Veneer try-in pastes has been optimized to produce an even more reliable aesthetic match. An optimum treatment outcome can thus be achieved with even greater certainty. Remember the influence of the cement shade on the treatment outcome, and therefore the satisfaction of the patient should not be underestimated, particularly in the anterior region. The complete Calibra Veneer kit is shown in the picture. It contains both the actual cements and the try-in pastes in all available shades. The veneers are coated with the try-in paste that seems most suitable and tried in. The try-in pastes do not cure. The veneers are therefore easily removed from the tooth after try-in. While we are on the subject of shades, all Calibras are available in 5 different shades: light, medium, translucent, opaque, and bleach. Let us finish by summarizing the customer advantages and benefits. Most importantly, Calibra Ceram, Universal, and Veneer offer a tack cure window of up to 10 seconds, which ensures stress-free cleanup. The shade-stable chemistry helps avoid shade shifting over time. Calibra Ceram and Universal build high bond strength fast, which is especially relevant when used in self-cure mode. Thanks to its innovative formulation, Calibra Ceram can be used without a self-cure activator. Calibra Veneer has provided proven clinical performance for more than a decade. Don't forget about the upgraded, all-new Try-In Pastes. I would like to remind you that the full sales and marketing collateral on the Calibra cement range is available on Dentsply Sirona Sales Compass. Simply browse to www.compass.dentsply.de and enter Calibra into the search bar. Please ask your manager how to get access to Dentsply Sirona Sales Compass if you don't have it yet. This is the end of the training presentation. Thank you for being so attentive. Dentsply Sirona Restorative would like to wish you all the best when selling Calibra resin cements.